Okay, health risks of smoking. You probably know many of the health risks that are associated with smoking. Heart disease, lung disease, stroke, peripheral vascular disease, the risks of smoking during pregnancy on the fetus or on the pregnancy itself. These are things that many of your clients will already have when they come to see you. Now, what's the big deal about these health risks and how does smoking actually cause them? Well, primarily with smoking, it's the products of combustion that cause the harm. Now, if you ask smokers, and we do this sometimes, you say, what do you know about tobacco smoke? And they say, well, you know, there's the tar and there's the nicotine, and smoking's bad for us. And indeed, smoking is bad for us, and many of your clients will know that already, so there's really no point in going through with them and telling them off about how bad it is. But it's important to understand what the bad part actually is. So if we just pull this apart a bit, the nicotine is the chemical or the substance that people are addicted to. For smokers, nicotine has very little risk. There are some risks, but overall, nicotine's not the bad guy in tobacco smoke. It's everything else. Now there's the tar, which is kind of the black stuff that you see, or the brown stuff that people have on their fingers. And that is a whole concoction of different chemicals. Those chemicals can cause cancer. Those chemicals are involved in the development of heart and lung disease. And then there are the gases. And probably one of the most poisonous gases in tobacco smoke is carbon monoxide. Now, not carbon dioxide, as many of you may sort of refer to it as, it's CO, not CO2. Okay, so CO2 is carbon dioxide. We're talking about carbon monoxide. Now, carbon monoxide is produced when you burn something. It doesn't matter if you're smoking cannabis or you're smoking tea leaves, you're going to get CO produced when you burn it. Now, carbon monoxide binds to our hemoglobin. That's the stuff on our red blood cells that carries oxygen around the body. Carbon monoxide displaces the oxygen. Therefore, by smoking, you're simply decreasing your oxygen carrying capacity. Now, if you're fit and healthy, you may not notice this. But if you've already got lung disease, for example, and you're already struggling to oxygenate your blood, then adding carbon monoxide to the mix is not a good thing. Nor is it a good thing when you're pregnant. Because for the baby, they also get this carbon monoxide. And that is going to decrease their oxygen carrying capacity. And the poor baby is in a state of low oxygen levels. Carbon monoxide is also a potent fetal neurotoxin. It damages the baby's nerves. So carbon monoxide is one of the things that we can deal with instantly in helping people stop smoking. And you'll see this, and we'll talk about this later, when you're using your carbon monoxide monitor. So it's the products of combustion that cause most of the harm. And within that tar, I've already mentioned the cancer-causing agents. You will already know a number of cancers that are directly related to smoking. Your clients will probably know most about lung cancer, or maybe throat and mouth cancer. But they may not know about cervical cancer or bladder cancer. And for women, there's also a link to breast cancer. So having a good understanding of the health risks of smoking are going to be really important for you and your clients, because many of the clients that you see are going to have some of these health problems. But focus on the good part, on the silver lining, in that stopping smoking is going to have benefits. For example, those of your clients with COPD, stopping smoking is one of the best treatments, For those that have had a heart attack, stopping smoking will reduce the risk of having another heart attack by half within the first year of stopping smoking. For women who are pregnant, stopping smoking is going to have clear benefits, not only for themselves and the pregnancy, but also their baby. And this is what we're all focused on, helping kids grow into healthy adults. And stopping smoking during pregnancy is really going to help that a lot.